members of our family that are joining us and our overall community. When I thought about what we were doing this evening, my mind drifted back to 2 years ago when we actually met Dr. Watson. We didn't know anything about COVID, and we invited him to help us to really administer flu shots to our family. And then very early in December, and there began to be conversations at the national level about this thing called COVID. And we engaged with Dr. Watson very soon after that and asked him for his opinion. But today we're gathered here together. We know about the effects of COVID because we're 8 schools and we have children that are ages 3 through 18. There are 500 of us that are engaged with Dr. Watson with different titles. Some of us wear the title teacher, and of course there's no one more important than a teacher. And then I'm hoping that parents are joining us because what they want to see, I think, is that the schools stay in session. But we welcome you, Dr. Richard Watson. And for those who don't know, I wonder sometimes when I text Dr. Watson if he doesn't think the school district again and those children. But Dr. Watson, thank you for always answering us. Thank you for being probably more engaged than you thought you would be a year and a half ago. For those that don't know, after really the small initiative of looking back of administering flu shots, Dr. Watson, I think, and I'll let him speak for himself, but all I know is what he did. And that is he has engaged with us in a learning process as we try to move our way through this maze called COVID. Nothing in my 40 years, Dr. Watson, has ever affected public schools the way this has. It's affected the way that all of us live. But you're aware, those that are on this call, that every Wednesday we've been having a clinic where we give tests, where we give boosters. We started out doing vaccinations, but then Dr. Watson agreed that he would help us to do COVID clinics on Saturday. And we've done vaccinations for over 600 students. But then the process of what goes on behind the screens and behind the scenes, he really has been the guiding light as we move through this thing called reopening in a COVID environment. And I know he's going to share with us tonight not only his wisdom. I learned a lot last year, Dr. Watson, when you described what the whole vaccination process was about. We're happy to tell you that among staff here in the 162 Southland family, we're about 92% vaccinated. We believe in vaccinations. We believe that that's the best thing to do. But I also want to compliment the staff, and your nurses know our staff that are not vaccinated very well, because even if you're not vaccinated, I do see some of the names on the screen, you have agreed to be tested every week. And so I think that the family, the 162 Southland family, is determined that not only will we keep our children safe, but we're trying to stay safe ourselves. So we are back 100% in our schools. We're teaching. We have no plans to go on Zoom, but Dr. Watson, I am grateful for everything that you do, for your advice, for your candidness, because sometimes you tell us more truth than we really want to hear, because we're just little teacher people out here trying to do the best that we can. But we have undertaken something that's huge for us. Every 2 weeks, we test 3,500 people. And what we're trying to do, Dr. Watson, and you know that very well, is to keep COVID the best that we can. We're not saying that we're perfect, but the best we can out of our teaching environment. And so all of us have masks here. We just probably are going to unmask for the Zoom, but we are masked, we're socially distanced, we're sanitizing everything. So one of the children said, if we stand still too long, somebody will probably wipe us off. But we're doing everything that we can. But one of the things that was in our minds is we really had to hear from you about what you think about COVID in general, what you're encountering. I know that you're tremendously busy, but first of all, to those who don't know, but most of you do, Dr. Richard Watson not only is a medical practitioner, a doctor that we respect, he is a friend of the family, and he has stayed the course. And, you know, Dr. Watson, when I think of the journey, and this has been a 2-year journey, this has been a long time, I'll tell you that. We're a little tired. We're a little tired. I don't know about you, but no matter what, whether we text, whether we pick up the phone, you always answer and you give us good counsel. So welcome, welcome, welcome. And we look forward to everything that you say. And if there's something that we're doing that you feel that we should not, then please give us words of wisdom and we will correct. So Mrs. Williams and Mrs. Dusky are our moderators this evening, but together, welcome, Dr. Watson. We're so happy to have the opportunity to hear your words of wisdom. And good evening. Good evening. Welcome.
Thank you. Thank you. Thank you. I appreciate those words. And I must say, you know, kudos goes to you and your team because the district certainly has stepped up above and beyond to ensure that the community, not just the school, but the community stays safe during these times. And what you've done is incredible. And I'm happy to be a part of such an enthusiastic and dedicated team. So, you know, applause to you and hats off to you and your team as well. So a couple of things that I wanted to just address as we continue throughout this pandemic. We have done a fantastic job in the community in terms of getting tested, in terms of being vaccinated. We're doing all the right things in terms of trying to be aware and trying to protect ourselves. You may hear, you know, changing opinions from different sources, you know, and I do want to say we're always available to discuss those opinions. And if you have questions regarding some new information, we're always happy to address that. As the virus mutates and changes, there's new recommendations, and with those new recommendations, there's new conversations, and we're here for those discussions as well. But getting back to what you all have been doing, the amount of testing that you've been doing has been nothing short of incredible. And now that we've advanced to not just testing in school, but distribution of tests to families to bring home, we're going to have even better results in terms of trying to suppress the spread of the virus. Testing, whether you're fully vaccinated, and well, I don't want to say fully vaccinated, I want to say if you've had 3 doses. If you've had 3 doses of the vaccine, or if you've just had 2, or if you've not been vaccinated at all, testing is going to remain crucial to trying to fight and prevent the spread of COVID. As you know, some people are affected dramatically by COVID. Some people are more fortunate and they have milder symptoms. There are still some people who are asymptomatic. And the only way to detect whether or not those people are carrying COVID is to test. So those antigen tests that we're distributing are going to be key and crucial to continuing to do well in the detection of COVID. So as we distribute those, we encourage everybody to please use them properly, and report your results, particularly if you are positive. If you're positive, we do have resources for you. I want to stress that. When we were testing just in school and at the COVID fairs, if you will, we would obviously, my team and I would be in control of determining those results, and those who were positive would be referred to further treatment, be that prescriptions or treatment inside the COVID clinic in Hazel Crest, or a simple monitoring. Now that we're doing home tests, it's a bit different because we don't know on our medical team, we don't know who is testing positive. And while certainly quarantining is going to be the minimum, we do want people to be aware that there are certain treatments that a person who's positive should have. Depending upon your risk factors, depending on your, depending upon your age, medical problems, severity of your case, your symptoms, different treatments may be necessary. I want to remind everyone that the virus literally works in two phases. First phase is the virus affecting the body in terms of a viral load. And the second phase is the body's response to the virus. That is that inflammatory cascade where the body just overdoes it in terms of trying to fight the virus, and really turns on the organs themselves, in particular the lungs, the nerve cells, the heart, kidneys. Those can lead to damage and to what we call long COVID patients. So I say all that to remind everybody that even though you may not have severe symptoms, we still want to make sure and suppress the second phase of the COVID infection. So check in with your physician, or you can check in with us in our clinic via telemedicine, or we do want you to stay home if you're positive. We don't want you necessarily coming out. We can do telemedicine visits. We have our website, which is emergetm.com. TM stands for telemedicine, so Emerge Telemedicine or emergetm.com, where you can go on, register, and just simply say you need a visit because you tested positive for COVID, and they will refer you to either myself or one of my physician partners. Somebody's on call every day for service, so that is available to you. And since we're talking about available treatments, I want to talk about the latest in treatments. There are a few treatments, a couple treatments that are available now that, in my opinion, are the best treatments that we've come up with along the way during this 2-year pandemic course. Monoclonal antibodies. Some of you may have heard of that. We've been using that. We've done the research. Those of you who know our office in Hazel Crest, a portion of the office is for research. And we were involved with the research for the monoclonal antibodies, which we saw very early that they were going to be successful. If you recall, the former president, when he got COVID and his staff members got COVID, they went to Walter Reed Hospital in Washington, D.C. and left 2 days later. That's because they got monoclonal antibodies. It was experimental at that time, but it was, the results were so good at that time that they gave it to the president without fear of dire consequences. So that treatment was initially only available inside the hospital setting. This past summer, the FDA decided that it was safe enough to be given in office settings and outpatient settings. And so we've been beyond the research now, we've been using that in the clinics, and we've seen very, very good results. It's usually about a 48-hour turnaround in terms of going from, let's say, a level 10 in your illness to a level 2, almost completely resolved. And those who are getting it are not having the long COVID effects. So that's very, very promising. Just recently, Pfizer came out with what I think most people have been waiting for, which is a pill. The pill is an antiviral, something called a protease inhibitor. What that does is stops the virus from replicating, gives the body enough time to kill off the existing virus. And so that is very promising. Again, one of those studies that was so promising that they stopped study short because it was proven to save lives. It's actually more than one pill. It's a pill packet. It's actually 3 pills that you'd have to take twice a day. The name of the medication, the name of the package is called Paxlovid, like COVID, but Pax, Paxlovid. Not available just yet, but they are ramping up production. And so I anticipate that we will start to see those prescriptions available to us in February. In order for those to be effective, you have to start treatment within 5 days of testing. And what that has shown to do, if you start taking that within 5 days of testing, it's not a cure. You're not going to instantaneously be okay, but it certainly has cut down on the need for hospitalization or even to go to the hospital. So it's for those of you who remember Tamiflu or can recall Tamiflu, which is a similar medication that we take for flu and flu symptoms. If you start the medication early enough after being detected, it cuts down on the symptoms dramatically. So this also shortens the duration of your COVID infection and lessens the likelihood for you to get long COVID or organ damage secondary to COVID. So those are 2 new treatments, relatively new treatments. The monoclonal has been around. It's the Paxlovid, Pax. That study started in 2021. And again, they will be available shortly. Again, the key to both of those is early testing and frequent testing, vaccinated or not vaccinated. Now, of course, if you're vaccinated, your general course, as we've seen, is going to be less detrimental and shorter in terms of how long you're going to be sick. But again, you can spread it to someone else. Just because you're not going to feel as bad doesn't mean you can't spread it to someone else. So having said that, masking is also still very, very important. The types of masks, as I always emphasize, are also very important. N95s or N95s are, quite frankly, the best that are available to us. As a matter of fact, in our next event, I was able to secure some N95s from the state, and we'll be handing those out to folks who come to the event. The idea, again, is to distribute as many of them as possible. Okay, the 95s are effective in blocking the transmission of the virus, and thus, we can contain the virus. The community overall seems to be doing quite well in terms of viral transmissions and infections. So I want to take my hat off to everybody for participating in events like this and doing all that they can do, proceeding with the science and not the rumors, proceeding with the science and not the politics. And that's how we'll continue to stay safe. So I'm
Thank you,
sure there's
Dr. Watson. Mrs. Dusky, I think we have some questions.
Yes, good evening, everybody, and welcome again, Dr. Watson. The first question is if people have had their booster shot. I've had several people ask me, and there's a question on here, do you recommend a second booster for people who already have 3 vaccinations?
No, I don't. The reason I don't recommend that at this point is, when we don't know if it's going to be necessary for another booster shot. And I tend not to say booster anymore. And the reason why is because we use the term fully vaccinated for 2 shots. And then all of a sudden, lo and behold, we needed a booster shot. So I call it the 3rd shot. If you recall some of your vaccinations as children, you got more than 1 shot, and you needed more than 1 shot to build full immunity. And I think that's simply the case here with COVID. Now, we'll see how long we have antibody production after the 3rd shot. And that's what I recommend. I recommend, it's a different type of test. It's an antibody test, but determining whether or not you have antibodies is significant. If you've had 2 doses and you've not had an antibody test and it's been about 6 months, I recommend getting an antibody test. Some people still have antibodies, and remember, antibodies is what's going to protect you from the virus or help fight the virus. So a lot of people don't after 6 months, and if you don't, you're susceptible. So I do recommend checking your antibodies. You don't have to check it every week. I say, once a month.
Mrs. Dusky, if I could, Dr. Watson, we're a little bit uncomfortable with the change that we received. First of all, it was recommended by the CDC, but we've received a communique from the State Board of Education and the Illinois Department of Public Health changing the period that people must remain separate and apart from us from 10 days to 5. It just seems to me that that's not logical and that we might be bringing people back into our environment. So I really wanted everyone to hear your position on that, because it's troubling. It just.
Yeah, it's interesting because some of my physician colleagues and I just this week have been enjoying a lot of the memes about the CDC and their various recommendations. Social media is really giving it to the CDC at this point, just because their recommendations have kind of been a little erratic at times. But specifically dealing with this one, I don't agree that you can test positive and then 5 days later you can go back, resume normal activity without verifying that you're truly negative. It's anecdotal, but I do see literally hundreds of patients a day with COVID, and many of them come back after the new CDC recommendations and say, yeah, I just wanted to check to see if I'm still positive. And I can't remember a case where they tested 5 days, came back after 5 days and they were negative. Many of them felt better, but they were still carrying the virus load. And again, carrying the virus load, while you may be feeling okay, you're still carrying a virus and you can spread that. And that's the thing. That's the reason for the point. It's not just so that you can sit and rest, which is, it's critical. You do need your rest. And if you're feeling good, that's great. We're glad that you're feeling better, but you can still spread to someone else. And that's how this thing keeps going. So I don't agree with the CDC on that. I think we had it right, with the 10-day stay. If you're so inclined and you want to be tested earlier than that, I recommend 7 days. But even at 7 days, it's a 50-50 from what I've seen throughout my clinics. So people are feeling better, but they're still positive, and then they're quarantined again. So I think 10 days is good. If you're 10 days out, let me say this: if you're 7 days and you have no symptoms and you want to get tested, I would agree with that. I wouldn't say go back to work.
Okay, thank you for that. That has been a concern of all of ours since 1 week it was 10, the next week it was 5, and people were coming back, and some people are asymptomatic and they don't feel ill at all. And so I think that was part of some of the rationale that they were feeling. But I have several questions here about the monoclonal and Paxal COVID. What symptoms do you need or would you have to be able to receive those medications?
So it's you can't just give just because you have symptoms. And I'm going to tell you why. Your initial symptoms when you have COVID and I've heard, if I've heard one, I've heard 10,000 people say, oh, I just have a little sinus symptoms. And so the initial symptoms with COVID, are typically runny nose and postnasal drip and maybe a slight cough. And that's not specific. And so you can have those symptoms with the flu. And you can have those symptoms with a general colds or some other minor viral entity. The problem is with COVID, it progresses so much more. And so again, testing becomes very important at that time. I've had folks come in with symptoms and we tested them and they were negative for COVID, but positive for flu. Different treatment, different medications. So the knowledge is going to be key in terms of the treatment. Once we test you and you're positive, then we can prescribe the Paxlovid or the monoclonal antibody injections.
Mrs. Dusky, I do see a couple of parents asking what percentage of students tested positive and negative with our last 2 testing cycles. For the first testing cycle, we had 2,727 students tested negative and 57 students tested positive and were in quarantine. Obviously, parents and teachers who are on the call know that we tested again on Martin Luther King's birthday. At that time, 2,774 students tested negative, and the numbers of students that tested positive are 30, and they are outside of our environment. We had similar results. Staff during the first testing cycle, 457 negative, 23 positive. And then with the second testing cycle, 458 negative and 16 staff tested positive. I guess I would say to parents, we're screening our environment. We certainly can, as long as tests are available, and I don't know how long that would be, but we certainly are firm with the next testing cycle. We will continue to screen our population and to do everything that we can. If you're a parent or a teacher that's on this Zoom call, we will continue to mask, we'll continue to social distance, we'll continue to do everything that we can. But I don't really read that much into these numbers, and I certainly would ask Dr. Watson for his opinion. What I think is that our community is very conservative, and we've been protecting our children and keeping them the best that we can. We certainly are not perfect away from exposure. And I look at the second testing group as the exposure due to Christmas and all the holidays and all of this perhaps is out of the way. And but I do, Dr. Watson, anticipate the third test cycle. I think that's going to let us know where we are, and also whether or not what we're hearing on the news is correct. And that is the flattening of the curve. And I don't know how to interpret that, but you might. But for parents that are asking what our numbers are, this is where we are as of today. 30 students positive and 16 staff. And so I don't know, Dr. Watson, the question is, what can we anticipate going forward in terms of our state and therefore as members of the state? But we are, in a sense, a subculture, and this is simply where we are. And we've never had data before about our specific population, and therefore I'm glad that you're engaging in this partnership so that we know exactly where we are, except that we all know, everyone that's on this call and seated here in the room, that anyone could be exposed at any time outside of the environment. We can't prevent that, but what we're doing is simply screening. So this is where we are today.
I can say those numbers certainly are better than state numbers when you're comparing them. But like you suggested, what we've done is create a community effort, and in that community effort, we created a microcosm of how things should run or how things should be done. And within that, not to pat ourselves on the back, but it's become a effort amongst health providers, teachers, and staff, and community members, families, parents, and that's really how we've gotten to those numbers. Right? It's not one person, it's not one entity. It's all of us, particularly all of us who are here on this Zoom, and even some that are not, that have been made that possible. And so we got to keep continuing to do what we're doing. There's going to be ebb and flow with this virus. It's not over. We just experienced a peak around the holiday time. That's not abnormal. It's starting to level now. It will peak again. February is notorious for infectious diseases. So we'll see that. If the state chooses to lighten up on some of the mask restrictions, we'll see a peak in that at that point. And you don't need to take my word for it. You could look at history, recent history. Look at the states who've lightened their restrictions. The moment they did that, the levels went up. Look at Georgia. Look at Florida. The moment they lighten up on these restrictions, the numbers go up again. And so, we can take a look around and see what's going on and make those estimates in terms of when the peaks are going to happen again. So I think what we're doing is excellent, and it can always get better. We will adjust when we need to adjust, and we'll continue to work together.
We have a couple of questions regarding the vaccinations, and they're similar, and many of them are about how long after you have COVID should you get the vaccine, either first, second, or booster shot, and then how effective are those vaccines for people who have had 3 boosters and they're still getting the virus. They want you to talk a little bit about that.
So first part, when should you get the vaccine after being infected? My answer to all my patients is, about 2 weeks. If you're not having symptoms, about 2 weeks after you're asymptomatic. The reason being is because you want to give your immune system a chance to boost as soon as possible. There are cases where people get COVID and then a month later get it again. That's not fun. It doesn't happen that often, but it happens often enough, particularly in our elderly population. I've seen that more than once in hospitalizations with patients who were in the hospital for COVID and are back again with a new case of COVID, tested negative before they left, and back again with a fresh new case. So in general, 2 weeks, 2 weeks if you after your symptoms. Part two was what to expect with if you've had 3 doses.
Protected. Mhm.
So what we've seen is that people who are dosed with 3 doses of vaccine have some of the least amount of symptoms, particularly in the case of Omicron. Delta is still out there and still causing havoc, and Delta is still pretty virulent in terms of what it's doing to even with people with 3 doses of the vaccine. We've seen people with Delta and 3 doses remain sick for about 7 to 10 days, not needing hospitalization, fortunately, but being sick for about a week, versus some of the Omicron patients who have had 3 doses where they felt cold symptoms for a few days and recovered quite rapidly. Again, no foolproof plan in terms of not going to be infected or not going to be affected, but certainly your chances are significantly better. The risk of hospitalization, risk of death, risk of adverse effects, long-term COVID, what have you, when you have 3 doses of your vaccine.
There's another question. Oh, sorry.
Sorry, I just want to make sure I got the whole answered the whole question. In regards to the immune system, we know that people who had a vaccine and have been infected have the strongest type of immunity available. That's not necessarily how you want to get it, but it is definitely the strongest type of immunity available.
Another question was regarding the accuracy of the rapid test. And the question is, why do they often differ from the PCR tests?
So there's technique. And I've had this conversation previously. A test is a test, but a test without a history and evaluation, what we call pre-test probability, is less effective. And I'll give you an example. If I come in and I've been exposed to a person with COVID, I know I've been exposed to a person with COVID. I'm coughing, I'm sneezing, I have the runny nose, I have the chest congestion, my chest hurts. And this is day 1. And I go in and I take a rapid test, a rapid antigen test, and that test is negative. The physician or medical provider in front of me should look at that test and have a question mark over their head. And then the question should begin. Is this your first day of testing? Did we get a good swab? Did we do a good sample? If it's negative, you know what? Quarantine, let's retest you. Let's send a PCR that'll come back in a couple of days. Let's retest you. Okay, because the clinical probability without the test is high. That's what we call a high probability person, or high pre-test probability. I'm expecting that test result to come back positive. And when it comes back negative, I have questions. Versus a low probability person, somebody who's got no symptoms. They've been exposed, but it was just 1 day ago they were exposed. They have no symptoms. I don't anticipate that test is going to come back as positive. If it does come back as positive, in the case of COVID, positive is positive. If it comes back negative, retest. Quarantine, retest. We're not so certain, particularly if you have a pre-test probability. In regards to the PCRs are funny tests, because if they are not done correctly, if they're not swabbed correctly, they can come back as negative. I know they're the gold standards, but if they're not performed properly, it can come back negative. I've seen more false negative PCRs than I have seen false negative rapid antigen tests. The other thing about a PCR is that once you're positive, that PCR can stay positive for 3 months. And so if you've come up positive for COVID-19, I don't recommend you get another PCR test for at least 3 months because your test is going to come back positive. At that point, you should be getting an antigen test or even an antibody test to confirm your diagnosis. And certainly that should be with some pre-screenings. So it's great that we now have home tests to give to everybody. But again, there is that question of what does this test really mean? Or, am I really negative? So if there's ever any questions or you have a positive test at home and you don't know what to do, or you think you have it, but your test is negative, again, feel free to contact us. We are available by telemedicine. Contact your physician if you have one that's available to you. You don't have to try to figure that out on your own. There are layers and layers and layers to this thing, and all the talk and social media and media itself has really not made it easier for people to really understand what tests, when, why, and how to respond to them.
There was an earlier question regarding airborne versus on touching, does it land on tables? Is there new information regarding how you can capture COVID-19?
I think that I haven't heard anything new. It's the same as before. When you're touching surfaces, you be mindful.
Mm-hmm.
One thing I like about people wearing a mask is the mask reminds us not to touch our nose. In general, we touch our face. I think studies show at least 20 times in a minute in general. That mask on your face, reminds you that you're not to touch your face, not to touch your nose with your bare hands after you've, gone through a hallway or, put your hand on the railing in a staircase or what have you. So, the contact, the virus can live on surfaces for hours, which is why, wiping down, sterilizing areas is very important. But, I carry a bottle of sanitizer with me, small bottle, just about everywhere I go. I mean, as a physician, I'm used to washing and sanitizing my hands, in a room, outside the room, on the way to the room. Unfortunately, for everyone else in America, they now have to get used to doing similar. And so, again, if you're touching a lot of surfaces, remember, don't touch your face. Sanitize your hands, clean your hands. I like the concept of the mask on your face, not just for shielding airborne virus, but also for reminding people not to touch your face. And again, those N95s masks are the ones that are going to best serve you, or KN95.
Mrs. Dusky, if we could, I see several questions about sports.
Mm-hmm.
And Dr. Watson, we did pause our basketball program. The reason for that, at the high school level, we had 3 basketball coaches that were tested positive for COVID, and 6 players. On the elementary side, we had 1 coach and 3 players. The issue for us is traveling to other environments, and I'm still very hesitant of that. I think we could control our environment. I certainly think that if we continue masking and we continue doing everything that we can to establish as much as possible a negative COVID environment, that perhaps we can make sure that our children are safe. But to the parents that are asking that, that's a difficult decision, and it's a decision that I made at this time simply because I have to weigh the safety of the students when we go into other high schools. You cannot have competitive sports unless you agree to go to other venues, and that's the problem. Dr. Watson, we did try not going into dressing rooms and other schools. We tried everything, and we came back with more positive cases. But parents definitely, as we go into track, I know this is disappointing for you, but I don't know what else to say about it because we don't control any other environment other than our own. And so, Dr. Watson, you might be a basketball person. I don't know anything about you personally. You might think that we need to go out but another issue, I don't know if you watch, you know that the pros don't play with any mask, but the high school and elementary children are only required to have the mask down around their neck, and they never pull it up above their nose. So I don't know, but I'm extremely uncomfortable because I have to balance trying to maintain the health conditions of the students versus fun. And I know it's exciting, but they also have, in most of cases, people who are simply there to watch. So it hasn't worked for us. That's what has happened, more COVID cases. So I don't know if you have another opinion.
Well, you got to gear it towards the sport. And it's difficult. There's no question about it. It's very difficult because certainly when you're on the court, you're not going to run up and down the court with the mask on. We don't expect you to run the 100 with the mask on. However, when you're back to the bench, when you are not in active play, the mask becomes important again. Also important is the frequency of sanitizing. In contact sports, is just what it is. It's contact sports. So you will touch a ball that somebody else has touched right after they've touched it. You're going to be, very close to someone, and you're going to share things: balls, bats, batons, etc. It takes a lot of preparation to sanitize those things. It almost has to become hospital-like in terms of the cleaning. Anytime somebody uses something, it has to get wiped down before it's like going to the gym. You have to wipe the equipment down before you touch it. That has to be adjusted to each and every sport. I can tell you, in the NBA they do same-day testing. Right? So the day that you're playing, you have to test it, and we did that in Chicago high schools. Last year, we did same-day testing, both teams. I'm not sure if they're still doing that, but certainly that helps prevent somebody being on the floor who's positive and doesn't know it. Just right before the game. When I say same day. So those type of initiatives help, but again, it's not 100%. Somebody can slip through the cracks. Certainly, I think the athletes are required to be vaccinated, which helps. But again, there's nothing that's foolproof. Even the Bulls, they had to cancel games because they had 10 players with COVID. 10 players, and they were vaccinated. So what do you do? It's a very tough decision, but the best you can do is same day testing and frequency of sanitizing, and when you're not in play, stay shielded. And when I say shielded, I mean put your mask on, put your protection on.
I think I'll give those suggestions to our coaches, but to the parents that have questions, I'm looking at what happened when we traveled to other facilities and we don't have control over it. I heard what Dr. Watson said about the constant sanitation. That's not what's occurring on the bench. And so at this point, we're taking a pause in terms of basketball. We will go, I think it's very healthy for the students into track, but why don't we say that we'll continue to review this? And if we are going in a more positive direction as a state, then certainly we would take another look at that. And for the benefit of the parents, something we are going to do, because I know that we have this big, we have 3 teams. Everyone is anxious to play each other. Perhaps we do some intramural sports and perhaps we have the best of the best of the best, but we do it safely. And so that's where we are with that. But Mrs. Dusky, I see there are several parents that have other questions, and Mrs. Williams.
Yes, this is Yvonne Williams, Dr. Watson. We have a question. One of our participants wants a clarification. You mentioned that someone could get a vaccine about 2 weeks after testing COVID positive. But one of our participants is saying that at a recent event on site here, the nurses would not give a vaccination because they wanted the person to wait 12 weeks after testing COVID positive. So can you clarify that?
No, you don't have to wait 12 weeks. That was a former CDC recommendation. You don't have to wait 12 weeks. I don't agree with that. If you're
Okay.
well, again, not having symptoms, you're symptom free, then you can have your vaccine. So tell them to come back and tell them Dr. Watson said I can have my vaccine.
Thank you for that clarification. And then there was a question regarding eligibility for the 3rd shot. Are teenagers eligible for the 3rd shot? What's the range for 3rd shot?
Well, you know, 16 and over, you have your 3rd dose now. And I recommend if it's been 6 months, you can go ahead and get that. If you're approaching 6 months, you can come in and get antibody tested. If you come to our clinic and you get antibody tested and your antibodies don't show, I make a clinical decision at that point that you're going to get your booster early. Reason being is because I don't care that there's a 6-month time period at that point. The person is not protected at that point, and we want to give the person protection. As physicians, we have that authority to say, okay, no, this is a patient that I want to give that booster early to. So again, you know, if you come in and you have your 16-year-old daughter, it's been 4 or 5 months, we test her, she's got no antibodies. She's in an environment that I believe is an environment that is at risk to the patient, and I'm going to approve an early booster or 3rd dose.
More about the antibody testing. Does it tell you, well, there was a question about where can they get it and what does it show? But this question is specifically, does it tell you how many antibodies you have, or does it just tell you whether or not you have antibodies?
It tells you the presence of them. So it's not it's a qualitative, not a quantitative.
So testing negative for antibodies after being vaccinated 6 months, to get just the booster, would the booster help if there is no antibodies to boost?
Yes.
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 I'm
Yes.
glad you understood that question.
I did. I understood them perfectly.
Yes. Mhm. Oh, is there a cost for antibody tests? That's another question.
All tests are taken care of either by your insurance or because emergency med staffing is part of the CARES Act. It goes through CARES Act. So we just, as long as you're a citizen of the United States and can prove that, the tests are billed out to through the CARES Act. So it's a cost that's taken care of.
Mhm. And this parent has asked this question twice. Do vaccinated students still have to stay out of school if they continue to have a positive test result? I think what she's saying, if they've tested positive, they remain out of school for 5 days. And we had just said until they test negative using the antigen rapid test. If they continue to stay positive, test positive, what is your recommendation?
If they're testing positive with antigen, they're still infectious. They should stay home.
Okay.
If they're testing positive with PCR, that wasn't the right test to take. So if you go and get, and I mentioned this earlier, if you are positive for COVID and you've waited your 10 days and you go back and get a PCR test, it is going to say positive. It's going to say positive. You need an antigen test at that point. The antigen is going to detect active virus, not the presence or the past presence of a virus, but active virus. And if that test says no, negative, you can return to school.
And are the antigen test and the rapid test one and the same?
They were, rapid tests was initially a connotation for the antigen tests, but now we have rapid PCR tests.
Oh,
So we got to go back to saying, antigen tests.
okay. So the at-home test that we're providing to students and staff would be considered the antigen test that would allow the child, if they're negative, to return to school with no symptoms. Yes.
That's correct. That's correct.
So another question here, and this is maybe more for clarification on the school side, is the return date to school. Even though we're saying 5 days, now we're saying that return date is once they have a negative test result using an antigen test.
Correct.
Correct. Okay.
Correct.
Dr. Davis, there are a few questions in here regarding remote learning for students who have underlying conditions or families that have underlying conditions. Did you want to respond to the governor's?
Yes. I think there's I don't want to say a misunderstanding, but last year the governor mandated that all schools closed in-person learning and that we go on remote education. We did that. And then there was the possibility of us going to hybrid, and we did that, summer school, et cetera. The governor's mandate now says that all schools are to emphasize in-person education, and that is the only thing that we are allowed to engage in, unless if we had 10% of our population, which is huge, that's huge, 10% of our population that was positive, then we can apply to the Illinois Department of Public Health, and they will allow us to go on what they call an adaptive pause. An adaptive pause means that they specify and we agree upon a certain number of days that we can remain closed. It's not the same thing as we had last year, which means the schools just close and go on remote. There is no possibility of the Illinois State Board of Education approving anything like that. However, you do hear on the news, if you did not have sufficient staff to remain open, then an adaptive pause, which is 3 to 5 days generally, could be approved. Or if you have 10% of your population, we've never had those kinds of issues. Having said all of that, if you contact the principal in your school, we do have remote options available for those students who are positive, and they're available immediately. And so my advice is please contact your principal if you want to CC me so that I can make sure that there is an immediate response. but in all 8 schools, there is a remote possibility. But I don't want to give you the impression that what we're doing is the same thing as we had a year ago, which would mean that there is a synchronous learning where you see the teacher presenting and the students in the classroom. That's not what this would be, but all schools must provide ongoing education for their students. And what we have done is to hire 8 learning loss teachers who are going to be interacting with any students. I see a parent to say, as saying that they have health problems in the home. Then if you communicate that with to the principal, there is a person in every school that would provide that kind of ongoing education. If you're thinking that all of the schools, all of our schools in general are simply going to go remote, I don't see that happening. I don't see the federal government or the state moving in that direction. But if you were to ask me what I think is the proper way to educate students, that's why we're testing. That's why we're masked. Children need to be in school, but I do understand and I respect the position of those who feel that there are health reasons for them being at home. And we do have a learning loss teacher in every school, but please contact your principal and those services are available immediately.
We have one final question, and we would like your professional opinion, Dr. Watson. If you have symptoms but are negative, should you come to school?
No.
Oh.
So the guidance does say, recommend that you be symptom-free and fever-free for 24 hours before returning to school without fever-reducing medications. And doctor says no.
I don't have anything else to say to that.
Dr. Watson, if you had any guidance to give us as we go forward, what would it be? I don't know where the virus is going. I don't know if there's going to be another mutation. I just know that we're going to try and do everything that we can to protect our students and our teachers. Other than what we're doing, is there something that you see? If there a void, is there a recommendation that we have not implemented? Because even if we could prevent them from even internalizing this stress and fear, because in our population, we sense it among the teachers and the students. The topic of COVID permeates every conversation that we're a part of because everyone is thinking about it and thinking of ways to prevent. So I don't know if there's something that you see or a recommendation going forward. We would certainly welcome that.
I would just encourage, particularly now with the advent of taking tests at home, that if you are positive, do seek medical treatment. Even if you're asymptomatic, have that discussion with a physician, because again, there are things going on in the body that COVID does that is not known to everyone, and we don't want long-term effects. So do seek medical advice. Even if you test positive and you say, "Oh, I feel like I get," please just seek medical advice. Maybe nothing will change. If you get a physician and they're really versed in COVID, some things will probably change. So please do that. Outside of that, stay vigilant with the testing as these new medications come about and are available. Certainly, we have the monoclonals in the Hazel Crest office. We are anxiously awaiting the arrival of the Paxlovid, the packets, and so we're getting better, and we're almost there. Stay, get some sunshine, and don't go into this winter depression. This is depressing enough. Do something to do. There's some favorite activities to keep yourself happy. These are tough times, and we can't forget about mental health. But keep yourself in good spirits, and do remember, everyone, please, as I say always and before, drink your water, get your exercise, take your vitamin D and your zinc daily. That's what I got for you.
Thank you, Dr. Watson. We work with children, so there is a happiness always in that. I'm here with Mrs. Dusky and Mrs. Williams. However, whenever we feel depressed, we go in the hall and we see the children, and above their mask, you can see that they have hope, they have happiness. And I think that's what we're driven by. But thank you so ever so much for all of your help, and stay safe yourself. We'll see you next time.
My pleasure. We'll see you soon.
Dr. Davis, as a final comment, there have been several questions here that you might want to address looking toward the future. Parents are wondering what your thoughts are regarding 8th grade graduation events in the spring.
Oh, okay. I don't know if Dr. Watson wants to listen to that, but if you have a high school student, in other words, if your child is here at Southland, this is the smallest class that we've had. We have rented the Harris Theater. We will have an in-person socially distanced graduation, but it is time, and I think that we're ready. And so we will send you that information. If you're on the 162 side, an 8th grader, 8th grade parent, I'm sorry, that class is 3 times the size of the 162 class. However, remember last year we had 35 graduations. We can't do that anymore. And so we've rented 2 days, reserved 2 days rather, at the Tinley Park Holiday Inn. There will be formal graduations. The only difference would be that there will be 2 because we can't really go below 4 tickets per graduate. It's really not fair. So please proceed in your minds. There will be 8th grade graduations. At this point, we're not, I did see someone ask about trips. No, we're not going to Springfield or whatever, because children would be on the buses together, and we're not really comfortable with that. But we are looking at trying to establish a new normal. And so I do anticipate, no, we will have a high school, not anticipate, a high school graduation that is socially distanced and as beautiful as we can make it. And we will have 2 8th grade graduations at the Tinley Park Holiday Inn. Are there other questions that I did not?
One about masking. There's a couple questions about how do we handle children and staff that are not masking appropriately. And you go ahead and what you do in the hallways every day.
Well, we have signs that say mask up. We say that all day. Pull your mask up over your nose, pull your mask up over your nose. We'll continue to reinforce that. We provide masks, as you know. I really have not seen an adult without a mask, but students do tend to pull their masks down, and we'll just continue to do what we're doing. We have signs in the hallway that say mask up. We have videos, and so that is important to us. But I do want to mention that our boards, there is a court case against the governor that would reverse or eliminate really the practice of masking. If in fact that happens and the governor loses the case, then our board will vote again, because we do have local autonomy. We're going to stay masked. We simply cannot do that until we know that our children are safe. And so I did want to share that. Also, I see a question about class size. We're holding at the elementary school, we've hired 3 teachers since the Christmas holidays. And so we have no class at the elementary level that is more than 22 children. If you watch television, Mrs. Dusky, you know it's difficult in the teaching market, but we're out there moving every rock that we can, trying to hire teachers. But at this point, we've been successful, and I don't anticipate a lot of transfers in during the spring. And so I feel confident that we'll be able to hold at the 22.
Okay.
I don't see any other questions for me. So I would want to thank you And I do see that several of you are requesting contact information for Dr. Richard Watson. Mr. Eric Leitz is with us. I'd ask him if he would share that at the end. But thank you, parents. Thank you, teachers. Thank you, everyone. And I hope this was of use to you. Stay safe and good night.